In April of 2024, my body had gone into septic shock. I was intubated in a coma for about 3 weeks. Sadly, when you are suffering from sepsis, the medication that you need can cause necrosis in the limbs. You know, when I was laying in a hospital bed, completely immobile, with my limbs necrotic, it's your worst nightmare. My husband was frantically doing research online, trying to figure out what are we going to do next and how do we solve this. He stumbled across NYU Langone's Center for Amputation Reconstruction. We knew that if I were to live, then I would have a shot at getting my life back.
The first time I connected with Ellen's family, her husband called me. I immediately knew this was someone that we needed to help.
We met Ellen at a relatively low point in her life. She had 4 necrotic or dead limbs, both arms and both legs.
As one can imagine, the complexity of treating patients increases exponentially the more limbs that they have lost. So when someone has lost 4 limbs, the complexity is of the greatest magnitude.
From the first visit, we had to figure out, number one, we have to get these limbs off safely, make sure that she can recover safely, and then think about the reconstructive procedures to help get her walking.
Right after my amputation, I had to wait and to rest. And there was a period of time when I tried to use traditional prosthetic methods, and I found it very painful, and it was hard for me to stay out of the wheelchair for any length of time. Pursuing osseointegration was the smartest thing I ever did.
Osseointegration is a technique that allows a prosthesis to be attached directly to an individual's bone. The benefit for someone like Ellen is, first of all, it avoids having to use a socket on her legs, which avoids all the issues that come with that. In addition, OI will allow her eventually to put them on and take them off herself, which is essentially a life-changing situation.
I told them that I was going back to work. I gave them a certain date, and I said, we're gonna do this. I don't care what it takes. We are gonna meet this deadline. And we worked together, and they were working really hard, but it was worth it because I went home at the end of August and I walked into my classroom September 30th. Sorry, it's hard to talk about this stuff. Returning to the classroom was the best thing I think that's happened to me. It was getting back to my students and my friends, getting back to my everyday life. It was just everything, I think, to get back to work and get back to my daily routine. When I was sick, that's all I wanted. You know, I wanted to know that I could get back to the things I loved. I'm healthy, I'm happy, I'm mobile. There really is a future.